Bhekisisa is reporting, and other news media are now picking up on it as well, that the US government has put an immediate and permanent stop to PEPFAR-funded HIV organizations in southern Africa. PEPFAR is the President's Emergency Plan for AIDS, which was a fund that was launched in 2003 to help fight AIDS in countries with high HIV infection rates. South Africa, obviously, one of them. The founder and chief editor of Bhekisisa, Mia Milan, joins us now. Mia, good afternoon.
Good afternoon, John.
Well, I suppose this clears up the confusion of which there has been a fair bit about. It stops now, and it stops for as long as we're in charge, is the message.
Yes, I think to be clear, it stops for organizations with PEPFAR funding who get their money through USAID. Those who still get it through the Centers for Disease Control and Prevention, they are still continuing, but there's a lot of anxiety around, whether that would continue as well. But the organizations who got the letters this morning are the USAID ones.
And the CDC is also undergoing change as a vaccine skeptic is now in charge of health, and they're cutting jobs and not worrying about bird flu, and the price of eggs is going up, but let's not go there. What percentage of funds coming into South Africa for this work is PEPFAR, USAID versus CDC?
It's about half-half. About half goes through USAID, half through CDC.
Okay, so some money still coming in, but the future reliability of that money must be in some doubt.
So, yes, it's not like CDC projects will just go ahead forever. I spoke to a CDC-funded organization this morning. They've got money until the end of March. They normally get the money in quarters. So the temporary order from the court that they got for the CDC organizations is only for, while the 90-day review is taking place of these organizations of the Trump administration. And for the USAID ones, they have now confirmed with a court document, at midnight US time last night, that they've conducted all the reviews. I don't know how they did it so quickly, that they've decided who's going to stay, who's not. Around the world, they said 5,800 USAID-funded organizations will be terminated, 500 will stay. I'm not aware of any South African organization who got a letter who said, you can remain. So it's very curious to me, who would be these 500 organizations?
And if you look at the organizations that have been getting USAID funding, the Inova Health Institute, the WITS Reproductive Health Institute, and others, these are all people doing, I would argue, absolutely critically necessary work. We got last year around 8 billion rand through this funding. We are told by the National Department of Health that it is 17% of gross funding in this area, the rest provided by the South African taxpayer. But it's really hard not to see not a potential, but an actual setback of significant proportions to the fight to keep people from getting HIV, and once they get it, to keep them alive and healthy.
Yes, John, I think there are two levels. The one is the fact that they now have to close down and we won't have them. But the other level is how they're being closed down. It's disastrous when you close something down overnight, when it's in the health field, because there is massive confusion, there's a massive disruption of services. You don't have time to put other measures in place. And that makes the closing down so much worse. If there was a period of, say, 3 to 6 months in which they were told, you're going to close down now, there was time to come up with ways, but there was no time now. And, these organizations who received these letters this morning, they were told 2 weeks ago you can apply for waivers. The waiver rules were you could continue with treatment programs, but not with prevention programs. They were asked to go through all their work plan activities and pick which ones will qualify for the waiver, adjust their budgets and resubmit. They were in the process of waiting to we may be able to continue with some of our activities. Instead, they just woke up to letters that said it's over.
And the funding environment at the moment for this kind of work, I appreciate what you say about the terrible impact of it being done in the way that it is being done. bridging finance, longer term finance? What's the funding environment like to start scratching around for that money internationally?
So, the real solution is that health departments are going to have to, governments are going to have to increase their health budgets and spend more money on health. That is the real solution, the more sustainable solution. In terms of other funding, one of the challenges is aid funding around the world is decreasing. And there are different models that they're going to come up. One of the increasing models, which is not a bad thing, is co-financing. They tell you, we'll give you $20 for this, but you have to pay $8 of that, which is a good thing to encourage organizations. But funding to plug PEPFAR's gap, it was a massive amount of funding. So no one can, in a question of 3 to 6 months, come and say, we fill that gap. It's not really possible. I don't think there is so much money around. So while there could be partial funding, I don't think there's going to be donors who come up who says we can fund all of this. So we're going to have to look at the health department. We're going to have to look at our government. But, we know there's been budget constraints for many years in the health budget already, in all budgets. So it's a really tricky thing, but I do think the health department is going to have to come up with a very clear plan. They've issued some kind of plan, but there's a lot of criticism about it, that it's not clear enough and not detailed enough.
Thank you very much to Mia Milan of Bhekisisa, which she founded. Yep, and the letter which was sent to the organization saying that they're not getting any money says these lines: your award is not aligned with agency priorities, and that continuing this program is not in the national interest. And that's where I disagree. And I know that there are listeners. Nobody's contacted me yet with this opinion, but I know it's out there because it's reached me before, that the US has the right to do with its money what it wants to do with its money. Fair enough. I accept that as a broad principle. But isn't it in the best interests of America? Isn't it in the best interests of America, the national interest, for there to be a unified world, a world where some people are not incredibly rich and other people are incredibly poor. Some people have access to great health benefits and others are scrabbling on the sidelines and getting sick. Those kinds of divisions, which can only be deepened by this very, very insular, because I think in order to make America great, you have to make the globe great. And that's where I fundamentally, conceptually, philosophically disagree with the MAGA program. The way to make America great is not to insulate America from the rest of the world.